I want to go across now to Dr. Naresh Trehan for a larger perspective, not just of what's happening at your range of hospitals, but what you see happening across the country, Dr. Trehan, in phase 2. How successful and how smooth was day 1 of phase 2?
So today was a good day in the sense that it actually people who have been in a panic all these months, especially the ones who are elderly or the ones who have comorbidities, they felt a sense of relief because they at least started registering. Thousands and thousands of them have registered. We were given 100 doses per center today, out of which 60 were to be reserved for the frontline workers who needed their second dose. And the 40 were for the people who registered or walked in for whom there was space. So that day has gone very well. The only thing that we saw in our hospitals was that a large number of walk-in people came in to register. So that kind of crowded the lobbies and stuff like that. But we were able to maintain the norms of COVID-appropriate behavior. So it all worked out beautifully. But we were prepared for it. So now this is the numbers are going to be ramped up in the next few days so that we go to from 100 to 200, 200 to more. And you can go up to thousands actually, like places, the hospitals like Medanta have 25 stations. So we could do 100 in each station, so 2,500 is easy. And we can double it if we extend the hours. So there is a lot of capacity available. What the government did a good thing was, one, that the prices are controlled. So for 250, including that 100 rupees, which is the allowance for the people or the hospitals who are going to administer the vaccine, it all becomes very affordable, and lakhs of people have registered already. Like we all have patients who are either heart patients or diabetics or cancer patients, hypertension, you name it. So there's a large number of people who are seeking us anyway, and that beyond that, so many other people are registered. So I think that this is a good move. What the Prime Minister did this morning also helped. And then the senior leadership like the Home Minister and others have also taken it, and they're talking about it. So now is the time that the hesitancy will probably go down significantly. And the ones that we are offering it to today are the ones who have been actually worried about the fact that when will they get protection from COVID. So I expect very large numbers to come in. We are registering them. And I think when we are full swing by next week, we would be vaccinating, I would say, lakhs and lakhs of people around the country.
Abhay Soi, what's it like at Max Healthcare? How many people were you able to vaccinate at your various hospitals through the day? What was the experience like? What are your plans for scaling up? Abhay.
So Rahul, this is clearly an inoculation drive of absolutely humongous proportions, never been done at this scale before. It's also a collaboration between the government via its application as well as providing vaccines and so on, and the private sector. We, for one, were able to vaccinate a little over 1,000 people today. The vaccination drive started a little later at about 12 o'clock because, of the huge amount of people who were uploading onto the COVID app. And as expected, a bit of a glitch over there as well, because just the volumes were absolutely immense. But I think by later in the afternoon, we were able to, and again, even to get our own processes in place, have been in place because we've been vaccinating our own healthcare workers. But to do it, to handle the sort of crowds who were coming at the hospital sites directly without taking appointments, it is something that one has to sort of get used to. We were able to streamline out of it. Tomorrow, I believe, will be a better day. Of course, there were hitches and glitches as one would have expected at various sites. But I think tomorrow is going to be a better day, and we should be able to ramp up significantly.
Now, one of the concerns, Dr. Trehan, that people who've been asking us has been around this possible side effects on those with comorbidities. Now, there have been some reports that there are certain kind of afflictions and if patients who suffer from those afflictions get the vaccine jab, then it could worsen their condition. So what's your view? Who are the kind of people who should potentially be careful, especially those with multiple comorbidities and extreme comorbidities? Is it safe for them to come to you and elsewhere and get the vaccine, or should they just see for a few days what happens to everyone else?
So there is some concern around the fact that people who have severe allergies, people who have experienced anaphylactic shock from whatever material or food product or whatever they had an allergy to. So there is a concern on that, and what we are doing, that's why we are appealing to everybody, please give your detailed history of allergies or the drugs that you know are conflicting. So today, there are almost every registration center has that screening process. And if we know that somebody has severe allergy or an experience in the past, we have the ways and means available to us that if, unfortunately, if they do experience something like that, we have the ability to actually treat it right away. So I don't think that there is any major concern, but you're right that experience will tell us. This is the first time, like I said earlier, this is a vulnerable population. This one we need to study. That's why I think it's a good thing that we started with 100 shots available today, 100 maybe tomorrow, 150, 200 ramped up. By the next week, we may go full blast when we have already around the country shared the data of any adverse events that may have happened in this group of population. So I think it's very important that we move cautiously. It's very important that we observe that half an hour, 45 minutes in some special cases before they are allowed to go home. So I think with all these in place, almost everybody can get the vaccine, except that the women who are pregnant. Now there is some question about the lactating mothers who are breastfeeding, whether we should or not. That's clarification, not enough data yet, but that clarification should be coming soon. So I think those are the categories that we have to exclude. Otherwise, almost everybody can get it.
Do you think, Abhay, that the Prime Minister coming out and taking the Covaxin himself will in some ways help mitigate against vaccine hesitancy? I remember asking Dr Trehan which one would he be more comfortable with, and he said Covishield. But the Prime Minister went out at AIIMS, took Covaxin, the Desi vaccine. Does that at some level, through his personal example, give people a higher sense of reassurance that if the Prime Minister has chosen it for himself, that it must be safe and you don't really need to be worried?
No doubt about it, Rahul. Not only in India, but I think throughout the world, our Prime Minister endorsing this vaccine is a huge boost, and I think many people who have been on the borderline as far as this is concerned will definitely step up. So, I mean, I absolutely have no doubt about this. I mean, even if we look at our own example, we've been able to vaccinate more than 20,000 of our own healthcare workers. And I do remember the first day when we, rolled out the vaccination drive, we had more than 50% cancellations. That means more than 50% of the people didn't turn up for it. But towards the end of the month, if you remember, the Ministry of Health itself had, roped in chairmen and senior people, senior doctors, etc., and run this campaign. And I think all of that helped a lot. And towards the end of the month, we had about 80 to 85% turning up for. And the Prime Minister endorsing this, absolutely no doubt. I mean, the huge following that he has, there's no question about it.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.